Hi everyone, and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledgelight Health District. The goal of this program is to bring you information on a wide range of interesting and important health topics, and to introduce you to the people doing great work across the community. Today, I'm joined by Ledgelight's two public health nurses, Chris Magnussen and Mary Day, to talk about the coronavirus, known as COVID-19. Welcome to Healthwatch.
Thank you.
Now, Chris, you are a longtime Healthwatch guest, but today I want to welcome Mary, who is new to Ledgelight. Mary, tell us a little bit about what inspired you to become a nurse.
Well, Carolyn, so I'm not so new to Ledgelight. I was an intern with Ledgelight when I was in high school. Then I went to nursing school, graduated, and worked as an acute care nurse and an emergency room nurse.
Wow.
And eventually went on to get my master's degree. And I worked as a nurse practitioner as well as an instructor for nursing and an adjunct nursing professor. So when I saw that Ledgelight had an opening for a public health nurse, I was so excited to jump right back in, and I'm very passionate about promoting wellness and health and working on disease prevention.
Excellent. We are so lucky to have you.
Thank you.
It's wonderful. So we're here to talk about COVID-19. Let's start with the basics. What is the coronavirus, and is it new?
So, coronavirus is not new. Coronavirus includes a family of viruses that contribute to respiratory illness. So that includes everything from some of the common cold viruses, SARS, MERS, and COVID-19, which people are hearing a lot about recently. So the different respiratory illnesses obviously can range from mild to severe.
Right.
So when we say coronavirus, we're including several different types of respiratory illness, but COVID-19 is, what is causing the pandemic lately.
Yeah, right. So it's not new. We're just hearing about it. So Ledgelight's role, we know that we do a lot of emergency preparedness work. Health emergencies require coordinated efforts from so many sectors. What is Ledgelight doing in the coronavirus?
So this is obviously a public health emergency. So we're sort of considered the subject matter experts, but also out there making recommendations based on science-based facts that we get from the CDC, World Health, and of course from the State Department of Public Health. But right now we're all working in what we call a unified command, where all of the partners are coming together. So we're working with fire, police, schools, you name it, CEOs. We're working with everybody and working together. Really behind the scenes, a lot of this is behind the scenes, ensuring that certain things are put into place to protect the public. So it really is, I guess you would have to say that we're the ones that people are turning to for information and what to do for certain situations.
Excellent. And as public health professionals, we're always thinking about emergency preparedness and planning for the next big thing. Why is coronavirus so concerning?
Well, we at Ledgelight, along with other, health districts, health departments around the country, we do a lot of public health emergency preparedness. And one of the things we've been saying ever since H1N1, which was our last pandemic, which thankfully wasn't a bad one, but we've been saying that one of these days we were going to be hit with, the big one, so to speak. And so there's been a lot of planning. We have plans in place. But of course, what you plan on paper is kind of put to the test when it really happens. And I think at Ledgelight, we're a little bit different than a lot of health districts because we've done a lot of planning and exercise, and that's really been key. And we've done it with our partners so that eventually when a vaccine is developed, we'll be able to do our drive-thrus like we've been doing for 8 years, and we'll be able to get it out to everybody quickly. So it's a very scary time for everybody. There's not a lot that we still know about the COVID-19. And so That's why it's frightening, because we don't know what's ahead. We hear a lot of things, and we have to remember, don't always believe everything you hear. There's a lot of rumors out there.
Right. So let's talk a little bit about the coronavirus. How do you know when you have it? What are the symptoms, and when should you seek medical attention?
So the major symptoms include cough, fever, and shortness of breath. And for most people, COVID-19 is going to be mild. However, up to 20% may have severe illness. So you want to call your healthcare provider, your primary care provider, when your symptoms, are not able to be managed on your own at home. If your symptoms are more than mild. If your symptoms become severe, you can call your doctor, but of course, if it's an emergency, if you have trouble breathing, that's when you would want to call 911.
Right.
And do alert them when you have to call 911, which hopefully people won't have to do. Please tell them the symptoms that you've had. We really want to protect our EMS providers and our healthcare workers. So please don't call 911 unless it truly is an emergency. And when you do call, let them know if you have a fever, cough, so that they can protect themselves before they come in. We can't afford to tax our healthcare system and our EMS providers, or we won't have the folks there to help us.
Right. I keep hearing a lot about that, for sure. So testing, that's a big thing that people are talking about. When do I get tested? Who does the testing? How do you get tested?
That's probably our most common question.
Yes. So we have a limited supply of tests available. And ultimately, it is the healthcare provider's decision who they think meets criteria for testing. The criteria for testing, you have to have symptoms, as we mentioned in the last question, and you have to have either had contact with somebody who is confirmed to have coronavirus, or be hospitalized with pneumonia, or if you have had contact with somebody who has traveled from what we call level 3 country.
That's important to know.
So I think one thing that really need to get across to people is that there's no point testing if you don't have symptoms. That's our most common call, because from the time you're exposed to possibly getting sick is 14 days. So if you're tested today on the 4th day and you think you're okay, there's no guarantees. So especially because we don't have enough test kits. But also, please don't demand these from your doctor unless you really are sick, and please don't go to the testing sites, the drive-through sites, unless you have already been cleared by your physician, medical provider to go. Again, the medical provider is the one that has to set it up.
Right, that's such an important thing to know. I know getting a lot of questions about that. One of my favorite things to talk about is prevention. Let's talk about what precautions people can take and how people can protect themselves, and what is social distancing?
Well, we were just saying that we could have done a little bit better here, but we're kind of stuck with where we're at. But I really want to emphasize that even though technically 20% of the population of those affected could be really sick, this can affect any age. And I see too many young people who are viewing this now as school vacation and then congregating together and hanging out together. And I can't stress enough that some of the things that are so important is social distancing. So if I happen to be infectious and I'm close to you and you're standing there for a while with me, you're breathing in my germs. Supposedly it can stay in the air for 3 hours. So this is why we're saying social distancing, a minimum of 3 feet to 6 feet ideally. The other thing that I can't stress enough is don't touch your face. If your hands are clean, that's one thing. But we get phone calls, I went to be tested and the chairs aren't clean in between. I go to the grocery store and, I'm worried about the groceries that I'm bringing home. Are they infected? you know what? The main thing is, if you wash your hands and keep your hands away from your face, those are key. Those are probably the most important things that you can do. So please, especially if you're older, if you have diabetes, heart disease, if you are immunocompromised, you've been through cancer, please stay put at home. Protect yourselves. In the long run, the more people that will abide by what everybody is saying out there with social distancing, then hopefully we'll have less cases, and then, hopefully less deaths. So far we've been pretty good in this area, but we know it's coming. Right. It's just coming. We see it's what's happening at the other end of the state. It'll only be a short while before it's here. So, hand washing. Don't touch your eyes, your nose, or your mouth. That's how things enter your body. Right. And try to stay a minimum of 3 feet to 6 feet away from people. Right. Don't shake hands. Be very mindful of what you are touching. So if you've gone shopping and you have hand sanitizer, use it when you get in the car. If you don't, be careful, and when you get home, wash your hands.
Right, so lots of general precautions, things we've been hearing about for a long time.
Simple things, but that's why we've been preaching this for years.
Right.
So.
Right. All right, so we're going to take a quick break. Please join us right back here on Healthwatch.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is, why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
Welcome back to Healthwatch. I'm here today with the 2 public health nurses from Ledge Light Health District, Chris Magnussen and Mary Day. And today we're talking about coronavirus. Just before the break, we were talking about prevention, which leads us to our next topic of cleaning and disinfecting. So how should people be cleaning their homes, and what do people need to consider?
Well, Carolyn, you want to make sure that when you're cleaning your home, you are targeting high-touch surfaces, what we call high-touch surfaces. So things like countertops, tabletops, door handles, things that people are touching a lot. And any household cleaners are generally going to be effective in killing the coronavirus. What you want to focus on is making sure that, with your whatever household cleaning product that you use, make sure that you read the label. So usually the label will say what viruses and bacteria it's effective against. You'd be looking for coronavirus in this case. And you want to make sure that you read the instructions. So for example, this product I have here needs to remain on the surface for 4 minutes. So every product will be a little bit different, so you want to make sure that you read the label for the instructions.
That's a really good tip. I learned something new. You got to read the directions.
So it'll also say sometimes SARS-CoV-2.
Okay.
But the nice thing about this virus is the way it's designed is that the envelope that it's sort of in is easy to kill. So that's why at home you could use your regular cleaning products. Out in the public area, then we would say definitely make sure that you take a product off the EPA approved list.
Very important to know.
Which most public places are aware of.
Okay, great. So this is now considered a global pandemic, and people are looking for information wherever they can find it, of course. We know not everything you read is correct. Where should people go for their information, and who are the most trusted sources?
Well, I would I implore people to get their information from the CDC, Department of Public Health, Ledgelight's website. Please don't believe everything that you read out there. Please be careful with rumors, because this ends up causing a lot of anxiety when people start posting signs as if they themselves are sick or passing rumors around, and it's not helpful. So people need to make sure that when they read Facebook, not to believe everything they see, or on Twitter. Please, go to the source. If nothing else, call 211 if you have a question, please. Get your facts straight.
That's a really good
we have a
point.
lot of rumors out there. We have a lot of misconceptions. And the other thing I want to say too is that as a result of it, there's a lot of stigma. And we need to all be banding together and not pointing fingers at one another, and we need to be supportive of each other. So make sure you have the facts, the correct facts.
Very important. So, you have to be living under a rock not to have heard about the big toilet paper craze. We've seen and heard about a lot of panic buying, sold out paper goods. Should people always be ready for an emergency? And what would you recommend people have on a checklist? How long should people be preparing for?
Well, we've been talking about emergency preparedness for years, and it's really, we're not a country that's very proactive, we're reactive. That's why you saw everybody running for the toilet paper, and I'm not even sure where that came from, but anyways. The Red Cross has been putting out great information over the years, as has FEMA, ready.gov, on how to be prepared. But unfortunately, it's not until a storm comes, or this pandemic, that people then realize they can't buy Tylenol and certain things aren't available, masks. So we always ask people to please, think about, if you couldn't get out to the store, do you have enough medication? Do you have enough food? So there's some great sites, Red Cross, ready.gov, FEMA, that have great checklists. And especially if somebody does require certain medications, or requires certain services, or is on insulin, things that they need to think about ahead of time. If I can't get them, what am I going to do? And I realize a lot of times people don't have the finances to be able to stock up, and that's okay. But think about those things that you really cannot go without, and try to think ahead. So if it's like a storm, if you know ahead of time, do you have all your medications? Please, I wish people, every time we have a storm, everybody wants to talk about what they can do to be prepared, and then they quickly forget this.
Yes.
I think this is going to be a long, hard lesson that people are going to learn, and I hope it stays with them.
Right.
And so that in the future, if anything should happen, they'll be a little more prepared and not all rushing out trying to get that toilet paper. Not sure why, but okay.
Right. I think there's actually a limit now on how much of certain things you can actually purchase because of that. So this has been such a big focus for the two of you for the past several weeks. What are some of the key messages that you really want to get out to the public?
Wash your hands.
Yeah, just listen to us, please. I've been doing this for 47 years.
Right.
Please listen to me.
Right.
I'm an old gray-haired lady. Listen to your mother. But anyways, you know what? I think, as with any disaster, and this is, a lot of good comes out. And there's some great good being done around here. And these are folks that are very quiet about it. And the folks that are working with the vulnerable populations, they're doing so much. We met a lady that went around her neighborhood and did a spreadsheet and talked to everybody, and if they wanted to give her information, she wrote it down so that if something should happen, she would have their emergency contact. If they lived alone, she offered to get them groceries if they were older. So I think things like this, it's been nice to see all the good. People have donated supplies, they've donated food. So as with every disaster, we do see good. Do see the good come out.
Sure, yeah. We've seen a lot of resiliency and, a lot of the good side of human nature
Absolutely.
come out.
And not so good sometimes.
That too.
Which is sad, but
Right.
hopefully that will change. We've gotten a lot of volunteers. We have a Medical Reserve Corps unit of medical and non-medical volunteers. And we've had a lot of calls from people wanting to volunteer. And so we've sent a lot of applications out. And so we're hoping that we can help the communities. In a little while, I'll be at the Community Meal Center in New London with some of my volunteers, assisting them as they provide meals.
Right. So wash your hands, be good to each other, and do what you can.
And that the situation is always changing. So what's recommended today could be different from what's recommended tomorrow.
Yes. So keep an eye on those trusted sources, right? And lastly, as we wrap up today, let's talk about the crucial role of the healthcare professionals. And we always hear about possible shortages. What advice can you give young people who might be considering a career in healthcare?
I think that if they are interested in pursuing a career in healthcare, first get your feet wet by volunteering. See if working with the populations that we work with is a good fit for you. And if you try it and you like it, then consider pursuing a career in healthcare, whether that's being a nurse practitioner, a physician, a firefighter, EMS.
Right.
There's public health.
Lots of important roles.
Well, I think anybody who's in this type of profession at the end of the day can know they made a difference. And I think that's really what's really nice.
Yeah.
I certainly feel that way. And so, as I mentioned before, the Medical Reserve Corps, please call us.
Yeah.
Happy to have you.
That's great. That's so wonderful. Certainly there are people who are working around the clock to keep us safe and healthy. And
I'd like to do a shout out to all of the healthcare providers in the long-term care, the hospitals, doctors' offices, everybody that's working behind the scenes. And they're working, especially as this advances here, they're going to be working on some really adverse conditions. So maybe if they're your neighbor, you could reach out and see what you can do to help them.
Right, that's great. Well, I just want to thank you two both for taking time out of your busy schedules to come and talk on Healthwatch. It's really been a pleasure.
Thank you for
Thank
having
you so much
us.
for having us.
And thank you for watching Healthwatch. We hope you'll join us next time.